We went on a hike while we were in Rwanda, and there were tons of little children that were coming up and practicing their English with everybody, and they were completely ignoring me. And I think it's because they thought that I was Rwandese, and so they didn't talk or wanted to practice their English with me. So I think it was really interesting because they really couldn't tell until they heard me talk.
They really want to learn. So they offer you like friendship, they are open, but they want also to learn from you. So that's something that it brings a lot of, it's really satisfying, especially when you're a student and you spend most of your time in a classroom, being able to transfer all the knowledge and be able to apply most of what you have seen for 2 years is really, it makes everything start to make sense.
Expectations were completely exceeded. The people were so nice. It was a beautiful country, so much different than what I had expected, because I've done a lot of world travels and I've never truly been to a third world country, and I think the closest I've actually come to it is growing up across from the border. And it was amazing to see this country thousands of miles away, completely cleaner and nicer than anything I'd expected.
We've heard a lot of stories about Africa, things going bad, but Rwanda is a different place now, and Africa in general is as well.
People actually are very happy. They are poor, they don't have much physical stuff, but they are very happy people. They are trying to make a difference with their life, but they're not like sit there depressed, like, oh, I own nothing. So I guess what I learned personally from this experience is that always thinking, positive, and try to, even though you don't have much at this point of your life, but there's always tomorrow that is going to come in. It's going to be much brighter than today.
See, you can't build this based on, yeah, they like it at $100.
Meet Rice University business professor Marc Epstein and his MBAs.
Because then what if it turns out you need to spend 90 producing and distributing it? You probably don't have a business.
Epstein and his students are in Kigali, Rwanda's capital, as part of a hands-on business course to commercialize 4 biomedical products designed and built by Rice engineers for the developing world. A lab in a backpack, a breathing aid for preemies, a battery-powered IV drip monitor, and a clamp to prevent oral overdosing.
What I'm saying is, even if the volume was higher.
It's their 4th working day in Rwanda, and Epstein is asking his MBAs to rethink the pricing model for their products.
That's why I'm saying whether it costs 3/4 of a cent or 1 3.
Epstein's laboratory is here in Rwanda, a tiny African country known for its beauty, its people, its genocide in 1994, its government run mainly by women, and its emergence as a safe and growing economy, despite the fact that the average Rwandan earns less than $1 a day and has a life expectancy of 46.
Working on very small margins, so the way you really increase profit is by driving down costs.
But the trip to Rwanda is just one part of Epstein's Management 748, an MBA elective that begins 10,000 miles away at Rice University's Jones Graduate School of Business, where in the first phase of the course, students learn about global health issues and microfinance.
We had a lot of material to go through just to learn more about the continent, more about social entrepreneurship, more about Rwanda specifically. So we had a lot of catching up to do just to understand how the continent works and how entrepreneurship works in the developing world.
The idea was to be able to have a rough understanding of what we were getting ourselves into so that we could be as productive as possible once we hit the ground.
Each day during their working week in Rwanda, product teams, each made up of 4 MBAs and a Rice Biotech engineering student, set their own course from their hotel headquarters in Kigali to demo their products and conduct interviews in hospitals, remote clinics, government offices, and NGO headquarters scattered across Rwanda. Days were bookended with breakfast and dinner speakers from banks specializing in social entrepreneurship, NGOs focused in modernizing Rwanda's healthcare, local entrepreneurs, and doctors who have devoted their lives to serving Rwanda. On their 4th working day, each team sent a representative to pitch their products to the Principal Secretary of Rwanda's Ministry of Health, Dr. Agnes Benegwahu, an official known for her sharp wit and intolerance for inefficiency. As it turned out, the secretary spent more than an hour with the students, regaling them to stay in Rwanda and leave their products behind with her.
There are so many people in the developing world that can be saved by just using technology in the services of what is already there. That they will save a lot of life without knowing. And I think that's the best thing a human being can never dream, to save others.
When we were going to Rwanda, I was very apprehensive. I was like, we don't have a plan. Where are our meetings set up? What are we going to go there and do? I just don't want to land there and sit in the hotel room. And so I was really apprehensive about the method of teaching before leaving. But I think reaching Rwanda, we realized that all the meetings had to be set up while we were there. And it is one needs to first absorb the environment before coming up with a plan of action for that environment. And I think that's what Professor Epstein enabled us to do. By letting us have that freedom, we actually developed our own business plan, our own impressions of the country, and learnings on our own. And I think sometimes not being spoon-fed and actually going out there and figuring out how to go about developing relationships in a new country is far better than actually just learning it over textbooks. So I think this combination of theoretical learning initially in class and being out there and totally going on ourselves and learning really helped solidify a lot of business concepts.
The approach I take is to try to stay out of the way and give them support where they need it, answer their questions where they need me to answer questions, but mostly what I come back with is more questions for them to try to improve their critical decision-making and problem-solving skills around this issue and really think through it well from the customer's perspective, who's going to have to buy this.
In the third phase of the class, teams returned to Houston to develop their business plans for turning their products into self-sustaining enterprises to hand over to interested entrepreneurs. The backpack team offered several versions of their product, from a diagnostic lab in a backpack to a customized pack designed for medical relief efforts. The team settled on a sales lease model where they would sell backpacks to governments and global nonprofits and lease backpacks to NGOs active in missionary and emergency relief. The CPAP team designed a two-phase business plan for their infant breathing support system, beginning with a product test phase in Rwanda and ending with a launch of their product to NGOs. The AccuDose team offered a C-clamp device that prevents oral overdosing of liquid medications. They split their markets into retail and wholesale, the retail segment partnering with a national syringe manufacturer and a wholesale segment where their C-clamp would be leased to global syringe manufacturers. The IV drip monitor developed a two-phase program, beginning with a pilot program in Rwanda and expanding to a production and distribution sales company that would sell their product internationally.
In a couple of decades, Africa will be one of the most important markets in the world.
We only had one opportunity to get in front of each person.
We're bringing healthcare technologies for the developing world.
While we were in front of, whether it be a supply chain person or an actual doctor of an important hospital, the necessary questions for those people were asked so that we had the necessary information to draw appropriate conclusions for the rest of Africa and the rest of the third world.
It's hard because you want to have economies of scale, you want to reduce your costs, you want to have manufacturing, and the infrastructure in Rwanda is really poor.
There's no real prescription when you go to developing countries. So if you did know what you were supposed to do on Monday, Tuesday, Wednesday, you'll find that most of those plans fall apart rather quickly.
So you need to import most of your materials or your final product, which increase the cost because it's landlocked. So it needs to come from Kenya.
When we went there with our smart drip device, I mean, doctors were just all over it. They wanted it. The Ministry of Health said, "We need this now." I mean, that's a quote that's ingrained into my head. And there's no question, if we don't do it, someone else will. And we hope that this happens, and we will make this happen. We're only building and getting better. Last year was a very preliminary trial, and this year I think the success that we've achieved has been great, and we hope that next year it's even better. And we want people to take this forward and take this device forward and make it a business there.
And I think what our students are involved in is really at the core of what this country needs. It needs entrepreneurship, it needs health technologies, and the combination of that is really a tremendous, going to have a tremendous impact.
Na mchezo wa matrezi mtoto wangu oh,